this is Dr. Jean-Martin Cohen Solal, where we're going to be talking about new technologies in terms of health. We're going to talk about e-health. Here's a little exercise. Let's project ourselves 10 years health. 2025. And let's imagine that there are lots of internet new technologies, let's say 2.0, as it were. So people will probably have bracelets to measure their blood pressure, their heart rates, and everything will be able to be collected and connected. So all this information, glycemia, cholesterol, what have you, in 2025, self-consultation will probably become very practical for most people. You'll be able to connect yourself if you're pregnant, if you want to understand what your body mass index is. And e-health will be absolutely everywhere and everywhere. Everything will be digital. The house will become connected. You'll be able to prevent and predict. You may be able to avoid treatments. Alerts, no reason to go rushing to the doctor. You'll be able to consult your doctor from a distance. And he will have all the information for you with his equivalent of Facebook from a distance. So most of the French will have had this information for methods for several years. Everybody will have a personalized subscription. They will be available and able to use it for 24 years. Doctors will have the whole health dossier. And this can be sent to the pharmacist, and the pharmacist will be able to send and release sending the medication to you. So in fact, we won't have medicine deserts, as it was, it's so-called today. If you live in a rural area, you'll be just as connected as if you live in an urban area. And everybody will have access to high-level healthcare. The same thing for chronic diseases, be it diabetes or heart diseases. People will be able to be in constant contact with healthcare professionals because of connected objects. So doctors within the community will have changed. This will enable them to be able to diagnose their patients with absolute precision without making mistakes. Because of the applications, the large number of applications, diagnosis of rare conditions will be possible. Doctors will have become a specialist in the treatment and diagnosis. And he will have to be also a specialist in human relationships. And all of this because of electronics. Some medication will be able to sometimes be able to send their own signals back to the doctor in case treatments needs to be changed. Everything that I'm telling you now may appear to be science fiction, but it's not really, because a lot of these things exist today already, and these exist already. What we are talking about for 2025 already exists in 2015. It's just not quite necessarily organized in the same way. Does this digital healthcare, e-health, is it synonymous with a fracture in the market? We've seen that there are applications. We've already had some presentations. Can they continue to be effective? But So what they've got to be able to do is not hide weaknesses in the system. They've got to embellish the system. So by using this digital system, it has to be used alongside some existing methods. What's the objective? It's to make the whole thing more egalitarian, more efficient, and make sure that there's more solidarity, and avoid, for example, that people like us say that things were better in the past. The whole point will be that tomorrow will be better than today, and this can be shared amongst everybody. Very important as well. Very important not to fight against this progress, but actually to go with it. One has to be forecast it, accompany it, and go with it. As I'm a doctor, and I've been a doctor for many years. I've seen very important changes happen within medicine. There have been big changes for many years, let's say at the end of the war and 1980s. The health system thought it could treat everything. They thought they were all powerful, particularly with antibiotics, for example, and a lot of infectious diseases, for example. And antibiotics were a revolution. And one had the impression that the health system thought that we had managed to overpower main illnesses, and then we've seen that. We have seen that's not necessarily always the case. Now we know how to treat diseases, but we can also have palliative methods of treating people for chronic conditions, be they serious or less serious. For example, we know, for example, that people with cancer can live for a long time. We can't necessarily cure it, but people can live for a lot longer with it. This is a huge revolution within medicine. Things have changed. For me, it's very fundamental to adapt to these changing times. And I think Jacques Attali was saying this morning, this life expectancy is growing and growing exponentially, and especially in France and developing countries. For me, tomorrow's medicine is all about four things. It'll be productive, 4 Ps. It'll be preventive, it'll be personalized, and it'll be participative. The 4 Ps. It'll be productive. For example, we'll be able to see what conditions people might be suffering from. Genetic, for example. So if you know what you might be suffering from, then you know how you're going to be able to treat it, and doctors will know how to be able to treat it. So up till now, that has been a problem. So there are certain genetic diseases that one will be able to know how to treat. Preventive. We can also be able to prevent and for example, complications. Let's take diabetes as an example. Diabetes today, so people can live correctly with their diabetes because of new techniques. You'll be able to predict it and prevent it. And when we become personalized, personalized, we'll be able to adapt the treatment for each and every individual so that everybody will be able to live with their disease. And these new techniques, day after day, everything will be able to be personalized for every individual, so that even right down to their own genetics and according to their chromosomes. Participative, P for participative, means that the people will be actors of their own health. For example, today, all the doctors know that there is not. So every patient goes straight onto internet, and this is a very good thing. The more that a patient knows more about his illness, then the better his recovery will be, and he'll deal with himself. So there's these 4 Ps. With the doctors will doctors have a major role or not? This is what doctors are concerned about. Well, is this going to get rid of the role of a doctor? And no, it's false. The role of the doctor will be completely different. He will accompany a patient. He will have an added value, but it will be different from that of today. And the more the patient is competent and the more he knows more about it, the more the diagnostics and the real relationship with the doctor and patient will be able to develop, because the doctor will be able to focus on his patient, and he'll be able to accompany him and help him. And the more doctors integrate these technologies, and the less fear he has, the better things will be. So it's absolutely indispensable to understand and take control of these new technologies so that doctors become involved in it. The theme of my presentation is new technologies. What will this give for social progress? And we want to reduce health inequalities in society, particularly in developed countries and elsewhere in the world. And if we want to make it more equal, then we want to make sure that, for example, we can see that people who smoke or suffer from alcoholism or other addictions, or maybe there's obesity, we want to be able to make sure that all these patients, we can apply the P's prevention and make sure that these people can be looked after. Now, in order to achieve this objective, new technology is going to be important. Is it going to be? Is it going to increase inequality, or is it going to help equality? It's important for us, we who work within the healthcare sector, and also for the insurance companies, health insurance companies, for whom I work. So we have to make sure that we're able to put in place systems whereby we can share all this information. And something obvious, for example, there are some areas where there are EPADs in certain areas, which are domains where older people can be cared for, and this means that they have healthcare. We have telemedicine, which is available, and they can be linked to these EPADs and then linked to the teaching hospitals, and it means that patients don't have to actually turn up on the spot. They can be treated at a distance. And this way, each patient can have the best healthcare available to them. So all players must be involved in this. And this is why as well that there are carers who are discovering new technologies. The objective is to get to know these and embrace these new technologies. It's not just a fashion; it's actually going to provide a real need. There are currently about over 100,000 new applications. There is plenty of new developments, and we have to make sure that these new technologies really do provide a function and not just a fashionable trend. If we want to improve the healthcare system, we have to make sure that progress is shared, real, and can be shared amongst the whole of the population. That is what I wanted to tell you to start the debate about digital healthcare and all the positive benefits that it can bring and be shared amongst us all. Thank you, Dr. Amin. I'm afraid we already had a problem at midnight. Laurent Alexandre, unfortunately, sent us a message on Twitter and said he couldn't come. He was going to talk about tomorrow. He said we're all going to live till 150 years old. And a lot of people are investing in new technologies. Do you really think this is a fantasy, or do you think it's real? If he'd been here, no, I'm not expecting you to suddenly change into Laurent Alexandre, but do you think we'll be able to live till 150 years? Well, yes, even with new technologies, I can't become Laurent Alexandre. But about 150 years old, well, there are graphs which show that you gain 3 months every 10 years in life expectancy. So at a certain stage, we thought we'd reached a plateau, but in fact it's not true. We're continuing. So I think, however, profoundly, and I'm not the only person, that it's a little bit of science fiction going on here, because there is a limit to the human body. We can't go that far. But it's true that we're exploiting progress and developing. And I've been around for a long time. When I was younger, and today you might call me an older man, but maybe I could have done a lot of things when I was younger in order to look younger today. So all the companies that are working in this domain have something amazing, a fantastic capital. They've got a lot of data. Google has a lot of data, and this data enables them to research ever and ever more deeply, and they can be able to work on prevention of certain conditions and pathologies. So there's huge progress being made in this area. At a certain moment, with Laurent Alexandre was talking about this. So I think maybe the whole thing stops at 150 years, but we see more and more people living beyond 100 years old. Let's hope that that at least will carry on. But what we want to avoid is early deaths, isn't it? Yeah. Okay, so thank you very much, and thank you, doctor, for your presentation.